have a very distinguished panel this morning to address this issue. And of course, you already met Kathy Griffiths from Australian National University. And we also have Jeff Coleman, who is the Vice President for the Regional Programs and Integration of Vancouver Coastal Health. And of course, we met Kendall Ho as well, who's the Director of the EMH strategy at UBC, and Michael Krausz, who Michael, you're joining the panel as well, right? So, who's the Addictions Chair at UBC and Provincial Healthcare as well. So, so the question that we want to address is whether we should have an e-health strategy and whether that should be a provincial-based or whether a national-based strategy. And of course, over the course of this morning, you heard a number of speakers describing the potential of e-health strategy, and we heard from Kathy about the Australian experience as well. And if we look back, you know, there were a number of researchers in Australia who had an interest in this area, and they basically were doing research and offering services, you know, depending upon the resources that they had. And I think in 2006, your government came along and gave something like $70 million. And of course, that sort of beefed up the resources quite substantially. And a number of researchers at various universities then started offering these services. And then, of course, it sounds like more recently the government realized, well, you know, yeah, we have all these facilities offering the services, but we somehow need to pull those things together and come up with a coordinated strategy. And of course, they came up with another $110 million, and they now have a national strategy. Now, if we look at our own situation in Canada, I would say we're probably at stage one, where we have some people in different parts of the country with some interest in this area and doing some research. But we really haven't had either provincial governments, or for that matter, the federal government, taking an interest in this area. Yet, you know, we heard from several speakers this morning that this is an area of huge potential. So the question is, should we go through the same trajectory that Australia went through, or should we say, can we learn from their experience and bypass some of those steps and jump on and start thinking about a bigger picture? So maybe we'll start with you, Kathy, given your own experience. What do you think?
That's really interesting because I think there's pros. I mean, I actually.
Can we get a microphone? Do we have a microphone anywhere?
I'll just try and project my voice, and if you can't hear me, just put a hand up and I'll keep trying to project my voice. I'm actually known as having a very soft voice, so I'll have to think about it. It's very interesting hearing you describe it that way, because I actually think that it makes sense to have policies at different levels, not, you know, one or the other, but probably different levels. But you know, the way we did it was that we engaged policymakers and brought it to their attention. If you if you did that at a provincial level, you'd be only focusing on. You might not have people in every province, if you know what I mean. Right. So going national means that you can combine your resources and combine your advocacy effort directed towards policymakers. At the same time, I mean, there's a lot of sense in trying to engage at the local level, you know, think global, act locally sort of thing. So I think there's pros and cons to that.
Okay.
Yeah.
That's good. Jeff, what do you think? You know, having been closely involved with health authorities and governments.
Yeah, so I was just going to comment on some notes I sort of took while I was listening to you talk, Kathy. And in 2006, when Australia was embarking on your strategy, the COAG strategy, we had a First Ministers Conference with the Premier and the Premiers and the Prime Minister, looking at investing some federal money. I think it was around 50 or 60 million across the province to bring down wait times in 5 procedures. You all remember that. So 5 years later, we still have a problem with wait times. Yeah. You know, one of the comments I would have to make is that I mean, I like the national approach. In fact, I like the international approach. I think they're necessary, you know, sort of precursors, and we do have the Mental Health Commission of Canada that can provide some policy, but someone else's slide was policy without progress. I think that was yours. If you look back in our history, if you look nationally, there's limited ability to really, in my view, influence rapid change. It's influencing change. It's a necessary precursor, but it doesn't get to implementation stage. If you're lucky, you get to policy stage. And why is that? Well, in our system, the provinces are fiercely independent and fiercely autonomous. And as you know, if you're going to give us some money, it can't be attached to any strings. We don't want to do that wait time thing again. So there is some real limitations with thinking that the national agenda is going to implement anything. It's an important precursor. Probably more questions, but provincially, we're also somewhat hamstrung because of our governance structure, where we have regions, 6 regions, who are also fiercely independent and autonomous and hard to control. That said, the province has a better lock on at least providing some direction, converting federal policy to provincial acts, if you will, or provincial movement. But it's still kind of an influence, cajole, set some strategy, and hope that it's taken up. Now, they do control funding, but it's global funding. So it's you get yours, and I hope you use it for this direction. So then that comes down, and it's a bit of a long-winded answer, I'm sorry. The next step, which is down to the regional level, where I think it definitely has legs there, and I can elaborate later on in this panel, but, and then regional, and of course local. And there's some compelling reasons why I think working at the regional level, that particularly in Vancouver Coastal, where we are talking a lot about this, and not just talking, but planning and doing, that's where we're going to have an opportunity. Sorry about the...
No, that's great. That's very interesting, Joe, because what you're saying is that you can have a policy or a brilliant strategy, but unless you have the mechanisms to implement at the end of the day, nothing is going to happen. And that sort of reminds me of the IBM CEO. He's not a CEO anymore, but it's a guy called Lou Gerstner. I don't know how many of you know this guy. He wrote a book called Who Says Elephants Can't Dance? And so this was in the 90s when IBM was in big trouble, and so he was hired as a CEO, and he basically said, everybody has a brilliant strategy, but at the end of the day, if you can't execute it, you can't make things work. So he completely transformed the way IBM did the business, and of course we know that it's one of those big companies that survived to now, even now doing exceptionally well. So I think it's an interesting perspective to take. Yes, one needs to have a good strategy, but at the end of the day, the bottom line is, you also need to think about what's pragmatic in terms of implementation. And I think your example about the wait times is highly relevant here. So maybe let's move on to Kendall from the academia perspective, having heard, Australian story and the health authority perspective. What do you think?
Yeah, really a fantastic, very insightful comment. Completely agree. I think my unit's also interested in the whole area of knowledge translation. Once you discover evidence, how do you then spread it out? I think one of the key things, one of the challenges and opportunity for knowledge translation is understanding local context. And the national, international framework can't get to it. And so, again, in the community, in the individuals, how do we organize services to support those individuals and work with them? I think that context needs to be put on the table. But I think it's also very important that in addition to understanding that context, how do we harmonize it in the particular region, in the particular province, in the particular national piece? I think as academic units, as health professionals, we can contribute that evidence to understand the evaluation, but to also try to harmonize the type of services. And so I think it's a really interesting dynamic to say, well, here's the context of this particular community in mental health challenges, some of the gaps, and how do we do this? But how do we look at the provincial, national framework and regional framework to say, well, how does that piece fit into the overall context of the province? And assisting policymakers in doing evidence-informed policy advancement. And then furthermore, how do we then continue to support understanding that policy, whether it has led to the right direction both in the provincial, regional, and also in the local context. I think in some ways it's a very iterative process, the way I see it.
Okay. So, Michael, I mean, you talked about almost international kind of strategy. So
I would like also to make it a little bit more interesting. I would like to contradict in certain regard. So I think clients don't care, and the internet doesn't care about provinces or cities or national or international. They just look for certain solutions, they look for certain advice, they look for certain information. And I think if I talk about client-centered, I think what I would like to see is more clients to find all those pieces. So the benefit, the interesting thing is, by the way, it's awfully brutal. And it is encouraging solutions out there which you probably don't even plan as a national or international solution. So the example was a few 100,000 people using MoodGem or whatever, probably far beyond your area or even Australia.